All right. Well, good afternoon, everyone, and welcome to a really exciting talk hosted by CHASI today. My name is James Mandigo, and I'm the provost and vice president academic here at the University of the Fraser Valley. And I want to start off by acknowledging that UFV is located on the traditional territory of the Stalo people, the Hakamelan speaking people of the river. And we are just so blessed and honored to be able to gather here in a good way, because of the stewardship of the Stalo people since time immemorial. And when we think about the importance of indigenization and infusing indigenous ways of knowing and being into our institution and learning and listening from the stewards of this land is so critical. And the work that we do every day to commit to authentic truth and reconciliation is so vitally important. So I would just ask those who are also joining online as well to reflect on the traditional territory that you're on and the contributions that indigenous people have made on your land and continue to make every single day. So today's event was established by the collaboration between the Cooperative University of Kenya, the State Department Cooperatives in Kenya, and UFV for the WINRAC project. And WINRAC stands for the Catalyzing Women's Involvement in Post-COVID-19 Recovery through Agricultural Cooperatives in Kenya. The overall objective of the research project is to understand the factors that underlie the impacts of COVID-19 on women's work, participation, and health in agricultural cooperatives. So just as a show of hand, how many of you are presently members of the WINRAC project team? You're in the room, see your hands. Great. Those online, you can put your hands up too, your virtual hands if you want. All right, see what's online? That's fantastic. And what an amazing group of talented researchers who are collaborating on critical issues around the world on this issue. The project is funded under the Women Rise initiative of Canada's IDRC, SHRC, and the Canadian Institutes of Health Research. We also thank the cooperative representatives in Kenya for generously sharing their experiences and extending our appreciation to the entire dedicated WINRAC research team for their contributions to make this project possible. This discussion will focus on community resilience in pandemic prevention and contextualizes resilience within communities to effectively prevent and mitigate the impacts of pandemics to enhance preparedness and contribution to the collective effort in preventing future pandemics. And we can all agree that that would be an amazing thing. I know for many of us last week, we transitioned online again for 3 days, and some of us had some COVID fatigue, or remembering from what that was like during COVID. And we definitely, for lots of reasons, don't want to go back to that. But also the impact that has had and continues to have on our communities as well has been longstanding. So at this point, I'm going to introduce Dr. Mbenze George, who's joining us, I believe, online. There he is. Hello. Dr. George is a Sessional Assistant Professor of Leadership and is Director of International Engagement for Africa at Trinity Western University. Dr. George was appointed by the Kenyan government as an Honorary Consul General in order to oversee and safeguard the welfare of its nationals and corporate bodies in Canada, as well as the economic trade, tourism, cultural, investment, commercial, scientific, education, and other interests and relations to Western Canadian provinces. On the global front, Dr. George has continued to engage and advise partners in developing nations by assisting with development projects and is dedicated to maintaining a reputation built on servant leadership, quality service, and uncompromising ethics. Most recently, Dr. George was inducted to the prestigious Pi Alpha 2011 with top academic standings in the PhD Public Policy Administration program at Walden University, United States, and is a standing member of the American Society of Public Administration. Please welcome Dr. George, who will introduce today's special keynote speaker.
Greetings. This morning, it's about 4 in the morning here in Chandigarh, in India. I bring greetings from my colleagues here in India. And I'm delighted to get this opportunity to be able to participate in this event. It is a pleasure that we introduce you to Professor Dr. Salome Bukachi, an accomplished academic, an expert in the field of global health, gender, and anthropology, and an integral contributor to the field of field for over 20 years. Throughout her career, she has held various positions at the University of Nairobi, progressing swiftly from a PhD student to a research officer, senior research fellow, and then currently as an associate professor at the Institute of Anthropology, Gender and African Studies. As a mentor and supervisor, Professor Bukachi has guided numerous graduate students, and her influence is evident in the completion of dozens of publications. Professor Bukachi's impact extends beyond academia, with recognition of her active involvement in regional and global initiatives through grants and fellowships from numerous prestigious institutions, such as the Africa One Health Network, the International Association of Ecology and Health, and as an integral part of the WINRAC research team as a gender specialist research associate. Professor Bukachi's contribution extends even further to serving on committees addressing water-related infection diseases and advising the World Health Organization on gender and intersectionality in infectious diseases. Lastly, and possibly most notably, Professor Salome Bukachi has recently been named as part of the World Health Organization team of 28 international commissioners tasked with preventing the next pandemic. Welcome, Salome, to University of the Fraser Valley, and to Canada, and to British Columbia. Thank you.
So greetings to everyone. I bring you greetings from Kenya, Nairobi. Right now it's warm, warmer than what is here, but I'm glad to be here and to be part of this. I'm honored to be presenting on my work in this place. So, all right. Let's see how this works. Oh, it seems like it has oh yeah. Okay. Yeah, so I work at the University of Nairobi as a as an associate fellow. As introductions have been told, have been rising over the years from starting off as an undergraduate student at the University of Nairobi, all the way to now being an associate professor in the same department. So today I'm going to present about community resilience in pandemics, and this will pick a lot from the examples of different projects and different opportunities or experiences that I have been part of, just to see how we can combine different disciplines together to be able to help deal with emerging health issues. So that will be the outline of my presentation. A bit about myself, maybe what has not been said. I'm a wife and a mother of 2 young adults. When I was growing up, my dream was to be a doctor. But when I went to high school, I didn't do very well in some of the subjects, the maths, the physics, the chemistry. So I found my strength ended up being in the humanities, and I found myself doing anthropology. And one of the courses in anthropology that I seemed to resonate well with, and maybe resonated well with the dream of being a doctor, was medical anthropology. So a lot about what I've done in anthropology is to apply my anthropological knowledge to help deal with health issues, but not just health issues. I've also cut across different developmental issues, be it in the water space, be it in nutrition, and various aspects. So as I indicated, I've studied in Nairobi, did anthropology. My first job in research was in a government research institution, doing research on human African trypanosomiasis, commonly known as sleeping sickness. Maybe for those who do not know about it, that will be homework to find out what is this disease called sleeping sickness. So after working at that institution, it was the Kenya Trypanosomiasis Research Institute as a research officer. From there, I moved on to the University of Nairobi to teach and do research. In all that I've done, I've also then become part of different global and local initiatives. One of the ones that has just ended, but a new term is yet to begin with new group of people, is the One Health High-Level Expert Panel. I was part of that panel of 28 expertise from all over the world that was giving guidance to the World Health Organization, United Nations Environmental Program, Food and Agricultural Organization, and the World Organization for Animal Health. And those three, we call them the quadripartite, came together with the realization of working together to deal with pandemics as a group. Besides that, I also love mentorship. And so I mentor a lot of the young graduates and young students just to also nurture them into the area of research. So the One Health High-Level Expert Panel, I've talked about it, is formed, the four organizations come together, which is called the quadripartite. And they came together in terms of realizing the importance of dealing with the emerging and re-emerging pandemics that have been there. And they realized that working together would help deal with these issues at a more collaborative, coordinated way. And so as members of the One Health High-Level Expert Panel, our advice was to give advisory to those, the quadripartite, in terms of guiding them in how they also guide member states in how to deal with emerging pandemics. Besides that, recently I was also nominated as a commissioner to the Lancet, as a Lancet commissioner on prevention of viral spillover. And this is about preventing future pandemics by reducing the risk of spillovers. This, a commissioner in the Lancet is about recognizing that we do not want to let pandemics come and then we start dealing with them. It builds up on the fact that prevention is better than cure. And building up from the queue of COVID-19, where a lot of money was spent in trying to deal with the management of the disease, outbreak response. There was so much that went into that. And of course, we know the impacts of COVID on our communities. So the Lancet Commission on Prevention of Viral Spillovers came up to try and find out ways that we can help prevent these pandemics from occurring by cutting the transmission between the pathogens and humans. So that's currently one of the latest things that I'm working on. And it brings in also expertise from different countries, different disciplines. A lot of this and work within the One Health space, both for the Lancet Commission and also the One Health High-Level Expert Panel, is dealing with emerging and re-emerging infectious diseases. When we look at these maps of the world and look at between April to June 2018, if you look at the cloud, the word cloud, some of the diseases that stand out, a key one is there's measles, Ebola, dengue, E. coli, among others, and anthrax we can see in Australia. Ebola in the West Africa region. We all know how that Ebola started from West Africa, but it soon became a global challenge. That notwithstanding, we also have the 2021, and COVID stands out quite clearly in that map. So these maps and these word clouds just show the emerging and re-emerging diseases that are cutting across the globe and affecting different countries, different nations, and affecting our populations in different ways. A lot of these diseases are as a result of different drivers. As human beings, we're interacting much more closer with our environments as a result of various factors. So when we look at the drivers, deforestation, intensive agriculture, pollution, urbanization, migration, intensive animal production, these have increased the global interactions of the human, animal, environmental interface. And as a result of that increased interaction, then chances of diseases spilling over from maybe animals to humans and vice versa have increased. And so there's need to pay attention to this, interaction and see how best can this interaction be managed so that then we are able to coexist in a harmonious way with all the aspects of the environment, the humans, and the animals. So the One Health high-level expert panel came up with a definition of One Health. When we look at that diagrammatic or pictorial presentation of the definition of One Health, what you notice is there are a lot of the C's where there's the wheels interacting with each other. And that interaction brings in the aspect of communication, coordination, collaboration, capacity building. And looking at that aspect, coordinating the different sectors and disciplines, coordinating society and different aspects of societies at different scales, all the way from local, regional, national, global, and coordinating the aspect of that interaction between humans, animals, and the environment. So within that pictorial, this is then the wording that explains that pictorial. So one of the things, the key things that we came up with as the One Health high-level expert panel was to come up with a definition of One Health, because we realized different people are working with that aspect of One Health in different ways. We're just having a discussion earlier now on One Health and seeing that One Health is not a new phenomenon. When we look at communities, indigenous communities, our local communities, they have had ways of coexisting together with the environment in a harmonious way before. It's just that now we are giving a name to what has already existed before. But we need to give it a name for us to be able to work in a common, with a common understanding. And so this is the definition the One Health high-level expert came up with about that integrated, the unifying approach that aims to sustainably balance and optimize the health of people, animals, ecosystems. It recognizes that human beings, the environment, and the animals are closely related and connected to each other. If I ask you maybe in this room, how many people have interacted with an animal in the last 1 week? I don't know how many of you would put up your hands. Yeah, good, almost all of us. What about the environment? How many of us have interacted with the environment in the last 1 week? So that just shows that we are closely connected with our environment and our animals. And what we want is that we live together with these animals, we live together with an environment in a way that is beneficial to the health of the animals, to the health of the humans, and to the health of our environment and the ecosystem. And that's where the One Health comes in to play. I needed to present that background about One Health so that when I move on now to the aspect of the community resilience in prevention of pandemics, we already have a background about the One Health approach. Because even as we're talking about community resilience, it's about how do communities respond to different shocks and different crises? How do they bounce back in the face of a disequilibrium in that interaction between the humans, the animals, and the environment? So several strides have been made, and we acknowledge that there's a lot that has gone into management of controlling outbreaks and pandemics. And a lot of the current interventions are about prevent, detect, preparedness, and response. But many times the interventions are at managing the outbreak when it has already occurred. It's about managing the transmission. For example, we saw with COVID. COVID was ongoing, and we're trying to see how do we break the transmission? How do we ensure that there's no new cases happening? How do we prevent people from getting the disease? But as we look back, we find that pandemics after pandemics many times get us unaware, and many times we have to do a firefighting to try and deal with what already has come. So how do we organize ourselves in a way that even when these pandemics come, that we are able to be resilient, our health systems are able to be resilient, our communities are able to be resilient, to be able to deal with these shocks in a way that does not ravage communities' livelihoods, food security, interactions, and various economic and socioeconomic aspects. So, because of the importance of communities in terms of resilience, and when I talk about communities, I'm not just talking about the local community on the ground, I'm talking about the different layers of communities. It could be health communities at a health facility. It could be a community of students. It could be communities in the rural areas. So they are all different groups of communities. So when we talk about community resilience, it's not just about the local communities, but it's all of us at different layers and different levels. So I just wanted to give examples of some different case studies of how different communities have responded to some of the pandemics that have emerged, and how different interventions have impacted negatively or positively in some of those communities. So we know about COVID, and it's very present in all our minds. We all went through different changes, and it changed how we do things. One of the things that stood out in our country, Kenya, and even Uganda and Zimbabwe, a lot of this, there's some literature that show all what I'm presenting, but I'll just give snippets about that. So one of the things that stood out within Kenya was the burial practices of communities in Kenya. During the COVID pandemic, because it was a time of uncertainties for everyone, the governments, communities. And so how do communities respond in the face of such uncertainties? So one of the things that the government of Kenya did, and the Public Health, Ministry of Public Health, was to stop group burials, group congregations at burials, because give it to the government, they also were dealing with something they had never dealt with. So one of the things that they said was that whenever somebody passes on, there won't be the normal ceremonies that are usually held during burials. And so there was one case of one man who died out of COVID, and his body was wrapped in a body bag, and it was carried by some of the public health practitioners and buried at night in a shallow grave. And communities were not happy about it. There was a lot of hue and cry about how the body was handled, given that in some of these local communities, the relationship between the living and the dead is quite connected, and communities have their cultural practices on how they go about burying their dead. And because COVID required that there were some public health measures that needed to be taken into consideration, the government did not want to know what was happening. The public health measures were strict, and so communities were not allowed to practice their burial practices. And so that brought in elements of distrust between communities and the public health measures. And of course, there was backlash in terms of communities adhering to some of these COVID-related public health measures, that some of them involved forced quarantine if you are suspected to have COVID, or maybe you are tested and one of your family members is tested positive for COVID, the whole family would be carried and taken on forced quarantine. And of course, this brought a lot of defaulting, because some people were taken forced to some places where had been targeted as quarantine centers, we would see photos of people jumping over walls to escape. But how best can we handle, how best could that have been done? I don't know if you have any idea on how best do you think this quarantine issue, the forced quarantine, should have been done. So maybe that's a question for you to think about even as we move along. The other case study, which is almost similar to the COVID one, is the Ebola outbreak in West Africa. I know you saw photos of health workers being chased, or some even being stoned. Unfortunately, some were killed by community members who did not want anything to do with the health workers during the Ebola outbreak. And it arose because of different views and perspectives about Ebola. Public health measures were put in place. From the global level, WHO had standards on how people who are suspected of having Ebola or who had died out of Ebola were to be handled. But there was a clash between the public health measures and the community practices or the community traditions. And what happens when there's a clash of these two different conceptualizations of things? Then it means that the interventions do not work. How do we ensure that in such times, community perspectives are taken into consideration and community knowledge is also leveraged upon to enable the public health measures work? One of the things that happened during the West Ebola outbreak was that social scientists were brought on board and they sat and talked with the communities, helped to unearth some of the practices and the ideas that the communities had about also their burial practices and their relationship with each other. And this information was used to work together with the public health measures to reach a compromise on how best can public health measures be implemented, but in a way that also takes into consideration the community perspectives. And as a result of that compromise between the public health measures and the community, they reached, they came up with an innovation, with an intervention that worked for both teams. And that's what solved the issues that were there during the the Ebola outbreak in West Africa. Finally, I gave a case study of the Rift Valley fever, which is a disease that's transmitted from animals to humans through maybe eating of the animal products or even just close interaction with the animals. And one of the things that a driver of Rift Valley fever is increased flooding. When there's too much rain and there's flooding, it produces a good breeding ground for mosquitoes which carry the virus. And so in Kenya in 2016, there was an outbreak of Rift Valley fever. And it happened in the northern part of Kenya, which is arid and semi-arid. Communities there are more pastoral communities. And so their livelihoods depend on their animals. So when there was the outbreak of Rift Valley fever, the government instituted some measures to help break transmission. One of them was they closed the animal markets. Number two, they stopped, they passed messages. There was messages that they were passing, airing over the radio, telling people to stop eating animal products, to stop drinking milk. Assume you're one of those pastoral community members. The government tells you you cannot interact and you cannot sell your animals, yet that is where your livelihood depends on. Then two, they tell you not to eat any of those products. What do you survive on? How do you survive? Those are the key questions that communities in this area were asking themselves. Because of the flooding, they were also cut off from government services, health, for both human and animal. Extension services could not reach them because of the floods. In fact, at that time, helicopters are the ones that had to come in to be able to bring in maybe some help in one way or the other. And we know that's also a cost. And so these communities had no choice but to still eat their meat and drink the milk because they didn't have alternative food. So in such situations, during such kind of a setup where there's an emerging pandemic, and yet your livelihood depends upon the very animal that is being said to be contributing towards ill health. How do communities cope? And how have communities cope? And these are some of the questions that we are saying that there's need to take into consideration some of those issues, even during pandemics, as a way of even helping build community resilience. So what's common about these 3 case studies? One of them is that sometimes help comes a little too late in some of these areas. The outbreak has already happened, and then the governments are saying, let's do vaccinations of animals. For Rift Valley fever, vaccinations have to be done before the disease sets in the animals. But now you see, because maybe we are caught unawares, we're not prepared, we start saying, let's vaccinate when already the animals are sick, which does not help. So the help comes in a little too late. The other thing is about one size does not fit all. Many times the interventions that come in during outbreaks or pandemics are standard interventions, but they do not fit into the different social, political, economic contexts within which these pandemics are occurring. The other thing is that top-down approaches. You find governments, or even at the global level, the international organizations talking about, let's do this, let's ensure people use masks. It's a top-down approach. And that's the case we see with all those case studies. The other thing is that they're non-inclusive or equitable solutions, which also relates to the top-down nature of this. And then there's little focus on prevention. A lot of it is about management of the disease, but there's little focus on management also of our environment. Maybe if we managed our relationship with our environments and our animals, it would help reduce contamination or spread of diseases. The other thing is about the uncertainties of pandemics. That's common across those stories. So in the midst of uncertainties, how do communities cope? How do communities remain resilient in terms of dealing with emerging and re-emerging pandemics? So one of the things that some of the studies we've been involved in, you've heard about the WINRAC project, is trying to also just look at some of the things, do research to help bring information that can be used to help improve on interventions that can help improve on community resilience and build the resilience of communities. So there's the WINRAC project, which Professor Sherry is part of, and I won't go into that much. There's a project we're involved in, which is Alive Africa. Some of this you can find more information online, looking at the role of animals in contemporary livelihoods and in the face of different changing livelihoods. How does the interrelationship between humans and their animals, how do they engage in the face of changes and in the face of health issues? Then there's COHISA, which is about capacitating One Health in Eastern and Southern Africa, building the knowledge about One Health, building the knowledge, advocating for the use of the One Health approach at the government level, national, and all the way even to the local at primary level schools to learn about how to coexist with the environments. And then there was the Gender Inclusive Vaccine Ecosystem Project, which was looking at how do we deal with barriers that different members of the community face in terms of utilizing, accessing vaccines and utilizing vaccines. So what are some of the key aspects that we can build up upon in terms of helping to build community resilience? The One Health high-level expert panel came up with some principles of One Health. And I believe some of those principles are core towards community resilience. Looking at aspects of equity, it's important that equity cuts across. We realized that during COVID, there was a lot of inequities in access to health services, in access to the PPEs, the equipments that were being used. There was a lot of inequities across the globe. So one of the things that would help strengthen community resilience is incorporating equity in how communities at different levels engage. The other thing is about inclusion and engagement of marginalized voices. We talk a lot one One Health, but what about the indigenous knowledge that has existed over the years? How do we rally on that indigenous knowledge to help us deal with what we are facing today? As an anthropologist, one of the things we talk about is looking at the past, learning from the past to help improve the now and to help improve the tomorrow. So even as we have technologies that are coming up, these technologies do not occur in a vacuum. There are communities who have lived and developed some technologies that are working for them. Why don't we go back, learn about those technologies, reflect back, look at our archaeological aspects, look at our historical aspects, interact with our indigenous communities and just see how have they interacted with this in this space without the pandemics happening? What can we learn and how can we incorporate that in our current technologies? The aspect of stewardship and responsibility, adapting sustainable solutions. We talk about sustainability. Even as we utilize our environments, we're talking about sustainability. That's a core that also helps to deal with, improve on our community resilience. Then the aspect of transdisciplinary, multidisciplinarity. We are all different people here with different expertise. How do we rally your expertise and my expertise and her expertise or his expertise to be able to solve a solution, a common goal, a solution? We bring in our expertise together and solve that solution, give a solution towards the emerging pandemics, rather than everyone working in their silos saying, I'm a geographer, I'm an anthropologist, I'm a sociologist, whatever fields, engineers. We all need each other to be able to work together towards improving even on our community resilience. So key considerations that we need to take into mind when we're looking at community resilience: addressing the inequities that exist. When we look at the inequities that exist, one of the ways we can address those inequities, I still go back to the aspect of appreciating the local knowledge that exists. Appreciating it and bringing communities, different levels of communities to the table so that we stop the top-down approach, but we co-create together as we build interventions that work for everyone. Long-term structural changes. All the countries, if we look at the globe, have gone through different historical, socio-political aspects. Even as interventions are being put in place to prevent pandemics, we need to take cognizance of those socio-historical, socio-political contexts that exists in which these interventions are being incorporated or implemented. That will help address the issues that we face. Maybe an example is in the Rift Valley fever in Kenya. The northern Kenya has been a marginalized area in Kenya. And so when you look at the infrastructure, it's not very strong. Health infrastructure, education infrastructure, roads has not been very much in place. So there's been a weak infrastructure in that area. So when we take into consideration the socio-political, the socio-historical context, is thinking about those aspects of marginalization and trying to see how do we remedy these aspects. Then I've talked about bottom-up approach, being inclusive, and a key thing is trust. In the Ebola case, there were missing aspects of trust, and that's why communities were revolting against public health practitioners and even chasing them away or stoning them because trust was broken. So building blocks of community resilience, relationships, solidarity, connections are so important. And we saw that during COVID, communities rallied on their solidarity, They rallied on the social relations in different ways to be able to survive the pandemic. Across all places, I believe there are stories we can talk about, but maybe those are things we can talk about later. But social relations is very key towards community resilience, as we saw during COVID. Local knowledge, have talked about, indigenous knowledge. Communication, information sharing is also a key consideration for community resilience. During COVID, even in places where the WhatsApp was not a very key thing, it became very key between communities in the rural areas, in the urban areas, doctors, and everyone had a way of communicating through social media. We know even our teaching changed. We had to go into Zoom and different platforms to be able to interact and still continue our interactions. So communities are able to shift, adjust to the different crises they face using different methods. Trust is also very important. I will listen to you if I trust you. Communities would trust their local leaders, maybe at the expense of someone else. And so working with the local leaders to be able to convey information to communities would work. It also needs to take into consideration the societal issues that perpetuate inequities. I've talked about the marginalization. And so that's a key building block that is important for us to take into consideration. And then social justice and ethics in pandemic control measures, incorporating that with social support systems. As I wind up, when we look at this picture, we start from the aspects of the reality. And even in the midst of working with communities and in community resilience, you find that the reality may not favor everyone in the community. You find that one person gets more than is needed, while the other gets less than is needed. And so you find, this is the point, you find this person is not able to see what's happening here. This one has a much of an advantage. But what we're saying is that we want to move from reality to move to equality, where everyone gets the same benefits and gets the same kind of support. But this equality does not take into considerations that we are not at all different levels. Communities are at different levels. And so we need to move it further and talk about equity, where everyone gets the kind of support they need to be able to deal with emerging pandemics that we're talking about today. But above all, we are saying that the best thing to do is to remove the structures that would prevent people from having access to prevention, access to health services, access to the things that are required to be able to deal with emerging pandemics. And so that brings in the aspects of justice for all, so that everyone can be able to access these services without any of those structural barriers. And so to conclude, working with existing community structures is important. Supporting and strengthening the existing communities, that brings in the indigenous knowledge, it brings in the community of practice, the health workers, among others. The resilience needs to be adaptive. Community resilience is not a static thing, but it needs to be adaptive to the various shocks. There's need to rally on the collective agency, bringing us together, working together, and building knowledge, sharing ideas. But the key thing to note is that resilience building is a process that is rooted on local relationships. So it's an ongoing thing. We can't say that because we are resilient today, we'll be resilient in the face of shock tomorrow. But it's something that we start building on so that our health systems are already structured in a way that makes them resilient, irrespective of whatever uncertainty they may face. So thank you very much.
So thank you so very much, Professor, for sharing your knowledge and your wisdom. And at this point, I'm inviting 4 panelists to come to the front and respond in 3 minutes each, which will be challenging, to what was just presented. So Tara-Lynn, Leanne, Professor Afia, and I think Kristin is online. So if you don't mind coming up to the front, and I'm calling it a speed dating panel. So meaning that their response should generate some questions and some interest from you all. So in the last 20 minutes or so of our time together, we're hoping for a bit more interaction. So I'll have each panelist introduce themselves and just a 3-minute response. And this is hard, so bear with them, encourage them. And maybe we'll pick on Kristin online first. So are we able to bring up Kristin?
You already have her.
Oh, perfect. Okay, Kristin, who's part of our WinRAC team and so important in every way to all of my work. Welcome, Kristin.
Hi, Dr. Sherry. Thank you so much. And thank you to Professor Salome Bukachi for the great presentation. Should we start with introductions or do you want to have the reflection?
Sure. Who are you? And then a reflection.
Sure. Yeah. So thank you. My name is Kristin Swardh. I'm a UFV alumni. I'm also a social worker, and I'm actually in Kenya right now. And my colleague is also online, Edith Kamuto. It's 3 a.m. for us, almost 4 a.m. So please bear with me if I look a bit tired, but what an engaging presentation. And thank you again to everybody. So many great points from what you shared, Professor Salome. I wrote down looking at the past to improve the future, and prevention is better than a cure as some of the key takeaways for me in this discussion, and just really bringing to focus the idea that COVID-19 is the most recent in a lot of our minds. However, there's a lot of pandemics, health-related, Ebola, measles, E. coli that folks have learned from and potentially implemented during COVID-19. So how do we move forward and learn lessons from this experience that for many was quite traumatic and still having to recover from, and the cultural implications as well too, which I think is what most of my reflections are focused on as well, and the idea of the fear that a lot of folks experienced, and just the idea of combating that through the community-led initiatives and the collaborative decision making. So I'm thinking about intersectionality theory in terms of I think my role as a gender expert with the WinRAC project. So with intersectionality being rooted in second wave feminism, mostly known by Kimberly Crenshaw, thinking about how gender dynamics, social cultural factors, and environmental conditions shape people's identities, but also their relationship between systems of privilege and oppression, which was so relevant during your talk, Professor. And so part of that being as well too in the Kenyan context, with a lot of parallels to the Canadian context as well too, with the nation's history of colonial legacies, social injustices, economic disparities that naturally are exacerbated through pandemics like this. And just the importance of the inclusion and engagement of marginalized voices, but in a meaningful way to build that trust and to combat the fear in terms of COVID and a lot of systems. And there's a lot of fear, and rightfully so, within communities who have dealt with a lot of these historical injustices. And so what does it look like to have meaningful inclusion and to have that collaborative decision making in a way that folks really feel like they can have affect change and build that resilience within their own communities. I think just to kind of end as well too is thinking about like encouraging collaboration between sectors, which again is so relevant in the One Health initiative. with public health, community organizations, local leaders, but also the community itself, who often has really great solutions to problems that they're dealing with. We say in social work that people know their lives the best, and they're the expert in their own lives too. So really just valuing that community knowledge as knowledge beyond academic as well too, so that folks feel like they can have more trust in some of these initiatives as well. So I'm really looking forward to hearing the reflections from the rest of our wonderful panel, and what an honor to be here with you all today. Thank you so much.
Thank you, Kristin. Well, clap. And I'm sorry, I never introduced myself. My name is Dr. Sherry Enns, and it's an honor and privilege to be here. And I'm a co-PI on the WinRAC project. Okay, so on to a next alum who still keeps staying around here. We'll welcome Leanne Joe, who I say is my friend and an advisor to the new planning program. So just a 3-minute reflection response. And I know this is challenging.
Aiswell, Sanakwea, Telsqueak, Talitza Quasta, Alis, Casta Mathaqui, Casta Keatsi. My traditional name is Sanakwea. My English name is Leanne. I am Stalo born and raised. So I really connected with the local, connected with and appreciated the parts that are appreciating the local knowledge. And thank you, Sherry, for asking me to be here, and for your presentation. I learned a lot. Sorry, I feel really loud. Like going back to when COVID was happening in my community. So I live off of my community I live in Chilliwack, and my home community is out in Harrison Mills. My home community was locked down. I wasn't allowed to visit my home. And that was their decision. So that was a bottom-up decision. And it was something that I think protected my community and my family at home. And it was a decision that our elders made because they lived through it before, with the smallpox pandemic. They had a lot of sharing and decision making, that they used the phone, and they followed previous experiences. And we keep as society, as humans, we keep going through these experiences, and every time we learn a little bit more. Unfortunately, we have to learn by experience, and that is the only way we really can learn more. But now that we've been through it in this lifetime, and we have people doing the research like you are doing, and people sharing the way you're sharing. So I really respect and appreciate the work that you're doing. So in my Halkomelem language, Kwasai.
Actually, we'll go to Tara-Lynn next, also an alumni that's still here and comes again, and a friend. Welcome.
Hi, Tara-Lynn Kozma-Perrin. I am an Urban First Nations and mixed European settler artist. I graduated with my Bachelor of Fine Arts from UFE, but also I'm in the process of attaining my Global Development Studies degree. And thanks, Sherry, for always inviting me to these wonderful opportunities. Also, thank you, Salome, for your amazing presentation. My key takeaways, I think, were the repetition of multi-sectoral disciplines collaborating with each other. I think that's something that we don't see enough of. Institutionally, we often get into silos. And so having our different departments and our different knowledge experts collaborating with one another from the very start is actually quite important. I took notes or else I would forget everything. And so one thing that I did want to kind of touch on from an arts and culture practitioner perspective was communicating. And so artists are one of the best communicators, in my opinion. We share stories, we share through various different types of ways that connect with the community and are often we're able to communicate complex things from an institutional perspective with community members. And so collaborating with artists from the beginning when we start working on projects like this, where we're engaging with communities, can actually help tear down those barriers of institutional jargon that's used in these situations and can help us build trust with the community. So if we collaborate with community engaged artist practitioners who are skilled in this perspective, and we start having them be sometimes our interpreters, for lack of a better word, to communicate with our communities when we're going in and talking about the pandemic, or we're going in and talking about certain vaccination or protocols that we're wanting to implement. I do think that they should be a part of that process. But that's still secondarily, because we're still going into a community and telling them what to do. Realistically, as mentioned in the presentation and by our other panelists, is the fact that we need to be collaborating with the community right at the beginning. So having these multidisciplinary approaches with artists being considered as potential collaborators in those conversations that are happening in the future. I did want to mention that during COVID-19, arts and culture skyrocketed in consumption. So a lot of people, when they were locked down, were utilizing arts and cultural resources to kind of help them through the process of being secluded. And so understanding and valuing arts and culture, not just as a commodity and as something that needs to be consumed, but valuing it and including it in policy always. And then it will help our health and mental well-being through any kind of problem that our community is thrown at. And so when we're talking about building resiliency in our community, consider arts and cultural perspectives when we're doing city building, when we're doing resource management, when we're doing pandemic preparations, just all of the aspects. I believe we should include that in those perspectives. Thanks.
So our last response before Dr. Martha Dow comes for Q&A, and thank you. Point in our program, we'll hear from Professor Afia Raja, also the chair of Planning, Geography, and Environmental Studies. Welcome, Afia.
Thank you so much, Eddie. And I can see all these familiar faces here, so I think we don't need an introduction. All of the students are here from Planning, Geography, and Environmental Sciences, most of them the familiar faces. So I would start with thanking you. It was a great presentation. Salome, right? Am I pronouncing it right? Yeah. So we could relate to lots of slides that you showed here. The commonalities in all of those case studies was a very, very interesting slide where we could kind of relate that the projects that we are doing here have relevant things going on with those case studies. We do have lots of overlaps, and then obviously the lessons learned going forward. This is extremely important because we want to get prepared for any kind of emergencies that we see in future. And this is where we learn from the community resiliency. So those aspects that we learn here, talk about, are very much relevant going forward. So the stuff that we recently did, Dr. Mariano is also here. So we did the heat mapping and planning response for the city of Mission, Lekamil First Nations, and we are doing it here for Abbotsford. In that too, we could see that the crisis preparation and the proactive approach towards things, that learning from these pandemics and the community response and the problems that come into overall the mistakes that we do in each and every case study here are to be learned from. So the proactive approach going forward, where we are looking at where we were looking at mapping our vulnerable population. We mapped people with disabilities, people with young families, seniors. So those being mapped, we were looking into how in future, whenever there's a heat wave, then how we are well prepared to face that and what strategies do we have to mitigate on it. So it was basically a learning lesson for all of us here, where we can suggest measures going forward, that wherever possible, how bottom-up approach can work, equity, diversity, inclusion, and how it comes in from the stakeholders who are involved in the process. So thank you so much for bringing in such a great presentation.
Thank you to our panelists, and you could just sit there for a bit in case there's a question for you. I'd like to welcome Dr. Dow, the director of CHASI, and I know many of you already know Martha, but welcome.
Thanks. I've got the easiest job. I'm just going to direct traffic. So we have an amazing opportunity with the panelists and Professor Bukachi to ask questions. If you've got someone you want to direct it to, that's fantastic. Otherwise, we'll try to match, and don't feel everybody obligated to answer every question, of course. I think we've got some mics that are going to travel around a little bit as well. So questions for the panelists, and Kristin's online too, so we can get to her as well. And obviously, anybody? Yeah, great. Right here, and then I've got you.
For the professor, you mentioned that One Health is a concept that was, it's not really young. It's not really new, because I used that as a theme in one of my environmental science classes. And that was, I think, 2013. And at that time also, I was showing a documentary about monkeypox. And at that time, there was no transmission yet from monkey to human beings, or from human beings to human beings, but there was monkey to human beings. Why do you think it took a long time for for the powers that be to use One Health again as the concept to integrate all these solutions that you have come up with?
You're up. Yes.
It's on?
Yeah.
Yeah, thank you for that great question. One of the things you've rightfully said is that One Health is not a new thing. And we have all interacted with One Health in different ways, not just calling it One Health. In terms of why it took long before then it got this global kind of interest, I think it's because we usually have different interests. Even at the global level, there are various priorities that are being given, different things are being given priorities at the global level. And unfortunately, sometimes it takes some of these pandemics to cut across barriers, geographical spaces, for people who are sitting in some of these top places to pay attention. So I think the reason why maybe of late it has become quite a common thing is because of the increased intensity of emergence of pandemics, of re-emerging and emerging infectious diseases, which are cutting across borders. Before, maybe they were localized in different places, but we are realizing that what is happening in Kenya today may quickly also happen in Canada. So there's need to find how to deal with it so that then it doesn't go all over. And maybe that has then made people at the global level, decision makers, come up with this aspect of One Health, which right now at the global level, everyone is talking about One Health. Thank you.
Question right there, yeah.
My question was for the professor. So my background specifically is around transcribing letter books around residential schools, as well as an artist myself. So I connected with a lot of what you were saying as well. When I think of community resilience and trying to build that community resilience, whether in the West or in all parts of the world, I see from kind of my looking glass, just a very difficult problem that doesn't have a single solution, where you could try to unite people in many different ways, but there's always going to be opposition from some type of corner. I see art is usually a way to connect people to kind of create that unity that will make people, the community, stronger in the long run. But I was curious, in your opinion, what is a good way or the best way to kind of build that resiliency and grow, connect people together?
I think the answer lies in what you have talked about. Using the different skills and expertise we have, recognizing that there are different things that bring us together. In some places, it could be music and dance. In some places, it could be art. In some places, it could be just sitting together and having a cup of tea together. That could bring us together. So my response to that would be to use what works in that area and not to close ourselves. And we need to think out of the box. Sometimes we find that we think only of what we've seen and what we know. But it's important that we also open up. I like the aspects you've brought out about art, using art to communicate. Why should we as scientists only communicate through publications? Why can't we draw our findings and use that to reach out to many other people who can learn from that? I know the Institute of Development Studies, Sussex, they have a program where they've been looking at resilience and pandemics. And one of the things they did was to put the information they found in a comic. So you have a poster, which is a comic, and it's bringing in the issues of pandemics and how to deal with them. So I'm in agreement with you that let's use what works, find out what works in a community, and not limit ourselves, but open ourselves to various opportunities. Yeah, thank you.
Just before we go to the next question, which is going to come online, I wonder if anybody else of the panelists wants to speak to that. It's such an important point.
Yeah, sure. So for our experience, a few projects that we've done within the community, in addition to what you already said, I personally think that trust building is something that needs to be worked upon, because wherever there is trust, only then there would come the aspects where we would be able to understand and respect the opinions and the needs of our society. So especially in case of First Nations, where Indigenous population, where we've a history where we've lost the relationship of trust, and we are in a process of rebuilding that relationship. So in all of those cases, I think, besides all of the factors that Salome has already mentioned, trust building is something that is a key to success. Thank you.
Just add to that a little bit. So like, didn't really elaborate very well what happened with my community, and it was like trust-based. When Dr. Bonnie Henry was giving orders and nobody wanted to listen, our chief talked to our elders and consulted with our elders, people who we've trusted for a really long time. And it was very trust-based. And our elders were people who survived the first pandemic, or their parents survived the first pandemic that was here on this territory. So they were experienced with this and they knew what to do. Like they knew how to conduct themselves in our community, and it was their decision to lock our community. And if you were in the community, you were in the community and not going anywhere unless you were an essential service worker. And if you were out of the community, like I wasn't allowed to go home, not to visit my dad, not to visit my sister. And it was just the way it was for several months. And it was trust-based, and I trusted the decisions that my elders made. and they went several months without getting COVID in that community. So, and nobody in that community died from COVID. I can say that. So.
Thank you. And all of your responses were perfect. I think also in regards to communicating, and we continuously bring up trust and the public's mistrust with institutions and the need to be able to rebuild those trusts. I really think in a Canadian perspective, when we're looking at municipalities, means community-centered planning practices. So if we start embedding those approaches in the way we build communities by speaking to those that we're building around, instead of just coming in and thinking that we're the knowledge experts, really localizing ourselves, listening to Indigenous perspectives, keeping a place-keeping approach when we're building or not build, or deciding not to build because of those different opposing perspectives, but also continuing to take perspectives of the community and how they want to live in their live in the environment will help us build trust with those individuals, and also builds a network that we can engage with when we have these emergencies. When we had these emergencies, as also mentioned, how did people communicate with each other? WhatsApp became popular in some regions. When we had the flooding emergency in Abbotsford, people didn't know where to find information. My family's property was completely flooded, and they didn't know what to pay attention to first. Was it Twitter or Instagram? Was it the municipality's Twitter and Instagram or Facebook? Was it a specific website? There was miscommunication that was completely rampant. So if we embed those communication approaches and almost those communication leaders in our practices right from the beginning, it can really help mitigate some of these miscommunication and trust issues that we currently have.
Great, thanks. I think we're going to go on, over to Zoom to Esha.
Hey, yeah, it's Isha. Can you guys hear me okay?
We can.
Perfect. So my question is also about the bottom-up approach and trusting our community. And it might be an ambiguous question, but I'm going to ask it anyways. So what is the best / ideal situation that we can implement the bottom-up approach within our community? Does it look like the government is preemptively asking the community some target areas that they think need to be addressed? Is it taking different people in different caste levels, different cultures coming together to form an alliance almost? And how do we determine the best representations or representatives to vocalize for these different communities?
Great, thanks. Kristin, do you want to take a first crack at that?
Sure, thank you. Thank you, Dr. Martha, and thank you, Isha, for the question. I think, yeah, and it's an important one, and I think it cuts across a lot of the themes that the presentation and the panelists have been sharing. And I think we often want to have these sort of best practices laid out at the beginning, but in my opinion, having flexibility in the approaches is so important. And it seems kind of cyclical, but asking the community how they want to be asked, asking the community how they want to be engaged with. For certain communities, they might be interested in like radio or like television, things like that, but we're not going to know until we have those conversations. So I think inherently in the bottom-up approach is we're not going to have all the answers at the outset. I think logistically having organizations or government engage in some of these conversations at the beginning is a good way to start these initiatives. But again, thinking about how that engagement is meaningful and ensuring that there's flexibility, I think is definitely important. Thank you.
Thanks. Professor Bukachi.
Thank you, Kristin, for that comment. I think I'll go back to the aspects that my fellow panelists have brought out. The aspect of trust is quite important in terms of the bottom-up approach. And what Kristin has said, that it's not a one-off thing. This is a continuous engagement. There are different layers of communities, and maybe different things fit in for different kind of groups. I think the important thing is to start somewhere, work with that group, let others see what is happening. For example, if it's government that needs that bottom-up approach, let the government start working with groups of communities. And you see communities are watching and waiting to see how will this pan out. If they see it working, then more people will want to also come in and offer the information they have, or just their thinking around whatever it is. So it rallies a lot around trust, but starting with whichever group you have, start somewhere and build up on that. Thank you.
Other questions from the audience? Yes, right at the back.
I had, my question is similar to Isha's. I'm glad that you answered it with trust again, but I have written down here, we have learn from the past to move towards the future and to build trust. So Dr. Salome, within your presentation, you gave a few case studies about the way that the government dealt with communities in a very sort of negligent way. I was wondering how, and sorry if that was my misinterpretation, but how can that trust be rebuilt in the best way from these communities that probably do not want to trust?
All right, I'll start, and I know there's a lot of wealth of knowledge beside me here. How can governments build that trust? One of the things is working through the existing local structures within the communities. In different communities, there are people who are trusted by various groups. Even maybe where we are, if you get information from a particular group or a particular social media platform, you'll trust it more than you trust the other. So my suggestion would be that government works, identifies the key people who are trusted in those communities, and starts working with those trusted leaders to reach out to the community. And in that process of interacting with these trusted leaders, let it be a consistent thing. And with time, people will start seeing that even as our leaders are telling us this, we see the government is also aligning or talking the same language with our leaders. Over time, that trust will be regained back. But building of trust is not a one-off thing. It's something that requires keep working at it, and it's a process.
Yeah, so we get to see that hesitation a lot when we are working with the First Nations. So we did approach like 2 or 3 First Nation communities where we wanted to our classes to do projects for, and it's not basically the government only who's facing that hesitation of building the trust. It's we as institutions, we are also facing the same issues, and how do we go about it is again very interesting, because we've seen that for specific First Nation locations, they have built the trust relationships with specific institutions, and they only trust those institutions and no one else. So when that situation arises, it's best to kind of do what we do in snowball sampling. That is, again, build relationship of trust with those whom they trust. And then we go from there, make our connections. And it's all about giving first. So whatever we have to give, we have to give that first in order to be in a win-win situation and in order to expect them getting involved. So all of these relations have to be done in a very honest, transparent manner, and it's a very slow process. So it would take time and it would take a lot of giving. But once we regain it back, then then it's a smooth road forward. Yeah.
That question. In the event of a pandemic that happens so quickly, how would an approach that we are saying is slow compare to perhaps a different type of approach? Would we have to, sorry, I feel like I shouldn't keep going on that, but
How do we speed up the slow approach is your question?
really
Yeah.
speed up the
Yeah.
approach or possibly have an alternative?
Yep.
I think it still goes back to these trusted leaders in the community. In Kenya, we had, when the outbreak of Rift Valley occurred, it occurred at a time when the pastoral community, who are also of the Muslim faith, had a religious feast that needed to be done. And that required that animals had to be slaughtered, these sheep they use in that religious festival. And with Rift Valley fever, that became a very high point of transmission if that festival was to be done. So what the government quickly did was talk to the religious leaders, the Muslim religious leaders in those areas. They had a meeting, they discussed about the disease, and they came up with a solution on how best the community would still be able to handle this religious feast, but in a way that protects them. And working through these religious leaders, of course, this is a pandemic, it's running, helped to avert people being exposed to the transmission. So utilize the existing local structure at that time and work through it even during that pandemic time.
Just a quick thing from a hyper-localized municipal perspective. If you want to trust your government or hope to trust your government, you have to engage with it. So voting is absolutely essential. And then municipalities have to go through public hearing. Well, it's kind of changed lately, but like there are public hearing processes attached to most major changes that they do. So having your voice be a part of that process, letting them know that you want to be able to trust them and forcing them to make decisions that are actually transparent, and being on top of them will force them to be transparent, and you'll start to weed out the people that you don't trust and start building a municipal environment full of more trustworthy people that we can then move forward and start building better relationships with.
Yep. Oh, sorry, just to add one quick thing. During pandemics, there's what we call the rapid assessment that can be done as the interventions are moving on. So it's important to do those rapid assessments, and in this case, to be able to determine who has high power, high authority in the community, and knowing, characterizing the key people who have power, who have authority, who can be able to make a change. Then you're able to know who are the right people to move and work with as things are moving on quickly. Thank you.
I think we have one last question, Andrea.
Mostly for the professor, but I'd love to hear everyone's opinion. Although COVID is now considered an endemic, we continue to see cases, and right now, according to wastewater data in the United States, among other data, we're in like the second largest surge since 2020. And I'm just wondering, with like, as we face these millions of new infections and continue to see the effects of long COVID and long effects, how do we as a community on a smaller scale and a larger scale both continue to protect our communities and educate them and prepare for future pandemics while dealing with pretty intense fatigue with dealing with this and political unrest surrounding this topic? How do we continue to protect our community and prepare going forward?
So super easy one to finish this off, clearly. Who wants to solve that? Why don't you start it? Yeah, start it, please.
All right, very good question and very practical given the current scenario we are in. Of course, and I agree with it in terms of COVID brought in interventions that we got tired of the lockdown. We're like, when are we opening up? We're tired of sitting at home and our businesses are not moving on. We need to move on. One of the things I would like to say is that there's nothing like the resilience within human beings in the face of whatever shock, because we were able to stay locked in. It impacted us negatively, but still were able to rise again and move on in life. So one of the things I would like to just say is that there's that resilience which we need to build upon as human beings to be able to help us deal with whatever we face tomorrow. And this thing of learning from the past, what went wrong, what did not go wrong, how best can we institute the measures that were put in place, is something that then we need to build up on the lessons we learned and use that to help deal with situations today and situations tomorrow. Yeah, I guess that's how best I can put it.
Anybody else?
I think there's a lady who raised her hand 5 times and we would like to take
And I
that.
missed it.
It was the lady. It was the lady in green. Sorry, I don't know your name.
Simran?
No, she's right here. Over there.
Yeah.
Simran, have you been waving and I missed you?
We're not going to ask the question. It's a longer question around quarantine and how it's affected in Kenya or Zimbabwe, where I'm familiar with people having to buy cars to get to work because they weren't allowed to take public transportation anymore. I'm not going to ask the question because here in Canada, we had temporary foreign workers come from different countries to work here and were forced into quarantine without their knowledge. There's a lot around the quarantine issue you raised in your talk, and we talked about it privately, but it's that. But just wanted to say, and your point about locking in your community and their choice to lock in. There's a lot of trust that's been lost in the public eye, but those that are working in public health still are continuing to say it's a need. You need to continue to listen and use those resources, like you said, the artists in the community. It's a consumption of art, but I resonate with what you're saying is using them as the voice to disseminate information is super useful to children. And we were super lucky that the pandemic didn't affect children this time around. Incredibly lucky that it didn't affect kids in the way that it could have. So I'm really glad you're doing the work that you're doing for the future and looking at what's happened. So thank you.
Thanks, friend. Sorry, I didn't see you there. Oh, okay.
For Leanne as well about the Indigenous lockdown. When your community locked down and the elders made that decision, was there communication with the other extended members of the community on how to did the elders share their knowledge with the pandemic with the broader community who may not have been living on reserve or in that community? And then post-pandemic, was there any communication or consultation with your community on how resilient they were and how the lockdown helped keep your community safe? Was your community consulted after?
Yeah, so there was, and there still is. There's still communication about it now, and my community wasn't the only community to do it. There's actually, so Kwantlen First Nation still has their gate up right now. They found value in keeping their community locked, and people have to check in to come in and go. And that gate didn't exist pre-COVID, but it is there now, and it's going to stay for the foreseeable future. And like, it was for the safety of the people, and it is something that existed, I think, pre-contact, was that when we were all living together in like close tribes, everybody knew when somebody new entered our territory, our community, everybody knew. But now that we all live in houses that are separate dwellings, anybody can come in and hardly anybody notices. But once that gate went up and there were security guards at the gate checking who was coming in and who was going and things like that. So that came from like, it was, we have like this, it's like this tribal government. It's not just one Stalo, it's not one Stalo community. Like Sta'alis is its own community. Chiacton is their own community. Matskwe is their own community. And all of their leaders got together and decided this kind of together. It wasn't just one alone. It was all of them worked within their limitations and their abilities to close down their communities and not allow anybody in and out. And it was something that they actually were sending, they had somebody who worked for the band who had a job that was like going, like their job was to run the youth center, but their youth weren't gathering anymore. So their job became going grocery shopping for the people. And then they were like, okay, this house needs this. Everybody gathered their grocery list, and that person's job became going grocery shopping for the people. They would spend their days going to get groceries and then delivering it to the people. And it was something that happened within the First Nation government in that community, and everybody's jobs shifted a little bit. The people who became security guards, their job was something else before, and then they all of a sudden got security guard training. They still got to keep their jobs, but it was shifted a little bit. And it was something that is continuing now, because there are still, like, we have gatherings, like our people are gathering people, like we travel together for ceremony, winter ceremony, summer ceremony, canoe races, whatever it is, we gather and we share food, we share meals. So for our people, COVID is still a really huge thing. Like, there are still practices, wear masks, use hand sanitizer. Like this room seems full, but in my life at a gathering, sitting like this is normal. Like how close together we are is normal. You're all spread out in the audience here. Everybody's spread out. That's not an option where I go to in the evenings or where my family is. Everybody sits really close together. So the chances of getting COVID are still really real. Like every other week or so, somebody's saying, oh, there was COVID at this gathering. Everybody test yourself. It's still happening. So there's still this, like, we all have to go to work and everybody's like more lenient, but it's still, everybody's having to check. Like, I'm sure my husband checks himself more frequently than most of you people do because of the life that we live. But so it's still being communicated very frequently. You know, there are still gatherings that get stopped because of COVID. There are still funerals that are shared on Zoom because of COVID. There are still other ceremonies that are available online because of COVID. Like right now, most classes at UFV And in high schools, I forgot to mention earlier, I'm a high school teacher. Like I can say right now, no, I'm not offering this course online because it's not COVID right now. I can say you have to come to the classroom, but at home in my community, everybody is still sharing things online because of COVID. Voting is still allowed online because of COVID. So it's still being practiced in our communities like COVID is still more active in our communities than it is in the rest of the world, I think. Do you want to add to that?
Great. Oh, yeah. Okay. So thank you very much. So I have the pleasure of thanking all of you for coming, both online and here. Sherry, your team, thanks for putting this together and having the faith to kind of reach out to CHASI. So much appreciated for including us in this. Thanks to the panelists, both online and here on stage. So thank you so very much. It's an interesting job being a panelist, being attentive and thinking how to contribute. So I'm deeply appreciative of that. Professor Bukachi, thanks for traveling. I'm so glad we were one of your stops. We all learned so much and inspired by what you had to tell us. And you know, Sherry and I were just talking, we just have to do more of this. I think in these times, these political times, we're losing the public square, we're losing spaces to share ideas and to have conversations. So I'm so thankful to have been part of this. So thanks, everyone.